Hello, my name is Dr. Diwan S. Raja. Today I will go through the trigeminal neuralgia. The trigeminal neuralgia is a facial pain syndrome. A facial pain syndrome along the sensory distribution of the trigeminal nerve. Okay. Usually, the maxillary division of trigeminal nerve is mostly involved, but the mandibular division of the trigeminal nerve may be involved, or both the maxillary division and the mandibular division may be involved. Okay. So, usually the maxillary division is mostly involved. Mandibular is second to maxillary. Mandibular division may be involved. Okay. Or both together is possible to involve, but V1 is not involved. This is the ophthalmic division. V2 is most commonly involved. V3 is second to V2, that is the mandibular division. So this is from this area there will be pain, sensation will be triggered to the trigeminal nerve. There will be severe pain that is carried by the maxillary division of the trigeminal nerve. Okay. So what type of pain in case of trigeminal neuralgia? Pain is excruciating pain. Pain is excruciating. Okay, we can call it severe pain, very severe pain. Okay, we can say it lancinating pain, and that pain is episodic paroxysms, of pain. Okay, that is triggered by just minor touch, maybe gentle breeze, smiling, shaving, or maybe just making up, or maybe due to some unknown reason, the pain may be triggered, and we have some trigger point around the lip, side of the nose, cheek area, even the tongue, anterior 2/3 of the tongue. These are the trigger points. From there, we get paroxysmal episodic pain triggered by just touch or chewing something, eating, or just breeze. Okay, or due to unknown region. Okay, we may have this type of pain. So, who is the patient? The patient is usually over the age of 35. As the age advances, chance of getting trigeminal neuralgia also increases. Okay, it is elderly person over the age of 35 or above. As the age advances, female more chance to get male may have that problem. Before the age of 35 is also possible, but chance is less. Right side is mostly the site of pain, right side of the face. Okay, more chance to get trigeminal neuralgia, but it might be bilateral. Okay, so this type of tic douloureux may be initiated spontaneously, without any reason. Okay, maybe after trauma, or after a dental procedure. Okay, pain is so severe, it may be worse than heart attack. It may be worse than a stone or a sharp stone is going through the ureter. It may be worse than that of the labor pain. Pain is so severe, person may not eat, and person may lose body weight, person may be very much malnourished. Pain is so severe, patient may even attempt to commit suicide. Okay, we got the type of pain, location of pain, possible trigger point from there, and what causes the trigeminal neuralgic pain. Okay, we have some secondary causes. Cause is mostly unknown. Okay, but possible causes or etiology like multiple sclerosis. We know that multiple sclerosis, the myelin sheath is lost. One of the ideas is that due to an aberrant vessel, there may be an aberrant vessel, aberrant artery, okay, that may friction over the trigeminal ganglion, and it may erode the trigeminal ganglion, the myelin is lost. That may lead to reverberating nerve potential, the nerve impulse potential, and that may cause the trigeminal neuralgia or aneurysm of the blood vessel, like that of the superior cerebellar artery, a branch of basilar artery. Okay, like superior cerebellar artery. Okay, or it may be due to some type of tumor. Tumor may be bony tumor. There may be osteoma in the posterior cranial fossa or middle cranial fossa, or maybe due to some type of tumor of the 8th cranial nerve. We call it acoustic neuroma. Or maybe osteoma, bony tumor that may irritate the trigeminal ganglion that is present at the anterior end of the pectus part of temporal bone in a covering of dura mater. Okay, so that may be these are the possible causes of tic douloureux or trigeminal neuralgia. Okay, we got the causes, possible causes. Actually, cause is not known, it is mostly unknown, but this might be the possible cause. And there will be reverberating action potentials due to loss of myelin from the trigeminal ganglion or from the sensory component of the trigeminal nerve. We know that it comes out of the pons from the anterolateral aspect. The big sensory component and smaller motor component It passes along the medial aspect of the pitta spot of temporal bone, going to the anterior end of the pitta spot of temporal bone, and there is a ganglion, and it has three division: ophthalmic division, maxillary division, mandibular division. Ophthalmic division comes out of the cranial cavity through the superorbital fissure. The maxillary division comes out of the cranial cavity through the foramen rotundum. The mandibular division comes out of the cranial cavity, both motor and sensory component, through the foramen ovale. Okay, we know that part. So now we'll go to the management of trigeminal neuralgia. Management. We have medical management, surgical management. Medical and surgical. Okay. Before going to the management, a physician always do the MRI, CT scan to find out the exact cause, or may go through the angiography to diagnose the disease, possible causes. So medical management by medication, carbamazepine. There is an anti-epileptic drug, but it works very good, especially over the sodium channel of the nerve, sensory nerves. Okay. Then our second choice is phenytoin. There is also an anti-epileptic drug. And third choice is a muscle relaxant like baclofen. Okay. So carbamazepine is not free from side effect. It may lead to blood dyscrasia, bone marrow suppression. There may be severe anemia. There may be hyponatremia because it works on the sodium channel, hyponatremia. There may be confusion, vertigo, headache. Phenytoin may be associated with gingival hyperplasia. Gingiva will be very much swelled up. There may be megaloblastic anemia. So adverse effects are always present along with the drug, but this is very good medication to manage a patient of trigeminal neuralgia, carbamazepine. Phenytoin to avoid an episodic paroxysm. This is a drug of choice. Surgical management, it should be done by the neurosurgeon. Okay, so we may give, we do rhizotomy by injection of glycerol to the trigeminal ganglion, and its sensory and the sensory part of the trigeminal nerve. Okay, ganglion. Or there may be radio frequency ablation, another management, frequency ablation of the cranial nerve 5, there is the trigeminal nerve. This is the management. So it is a problem of the sensory component of the maxillary division of the trigeminal nerve, maybe a problem of the mandibular division of trigeminal nerve, or both. It does not affect the ophthalmic division of trigeminal nerve, and it is a problem of sensory part of the trigeminal nerve. Motor nerve are not usually involved, but on a rare occasion, motor nerve may be involved, especially the muscles of mastication. Okay, we call it status trigeminus. Okay, status trigeminus. Okay, this is a condition when the muscles of mastications are also involved, along with the sensory distribution of the fifth cranial nerve or trigeminal nerve. Okay, so that's all about the trigeminal neuralgia. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice day. Bye now.